Diabetes is a serious health issue that is affecting an increasing number of people in modern society. According to WHO statistics, the global diabetic population surged from 108 million in 1980 to 422 million in 2014, and in 2015 alone, approximately 1.6 million deaths were attributed to diabetes. At the 2025 IDF World Diabetes Congress, the International Diabetes Federation released data stating that 1 in 9 adults worldwide, totaling 589 million people, suffer from diabetes, and 252 of them are not even aware that they have the disease. The term diabetes was first recorded in ancient Greece, but it is generally known to have originated from the Latin diabetes mellitus. Here, diabetes means to siphon or pass through, and mellitus means honey sweet or sweet. In short, the name reflects a disease where glucose is discharged through urine. So why does diabetes occur? Diabetes is a condition where the body cannot properly utilize glucose, leading to excessively high blood sugar levels. This happens when the pancreas cannot produce insulin, does not produce enough of it, or when the produced insulin does not function correctly. Insulin is a vital hormone that helps glucose in the blood enter the body's cells to be used as energy. When we consume carbohydrates, the body breaks them down into glucose, and the liver also produces glucose. If insulin is deficient or malfunctioning, cells cannot use glucose for energy, causing glucose to accumulate excessively in the bloodstream. Diabetes is primarily divided into two types, type 1 and type 2. Type 1 diabetes is an autoimmune disease where the body's immune system mistakenly identifies the beta cells in the pancreas, the cells that produce insulin, as foreign invaders and destroys them, resulting in a total lack of insulin production. Type 1 diabetes occurs regardless of diet or lifestyle habits, and since there is currently no cure, daily insulin injections or pump therapy are essential. It mainly develops before the age of 40 and accounts for most cases of childhood diabetes. Type 2 diabetes accounts for 85 to 95% of all diabetic patients. While it mainly appears in individuals over 40, incidence rates among children and young adults have been increasing recently. Type 2 diabetes occurs due to insulin resistance, where insulin exists but is insufficient or does not act properly. Major risk factors include being overweight, high blood pressure, low HDL levels, and a lack of exercise. Fortunately, type 2 diabetes can be sufficiently treated and managed through a healthy diet and regular exercise. Unlike type 1, the symptoms are much milder, so many people live without knowing they have it. The crucial point here is that type 2 diabetes is not simply a problem with the pancreas. People showing diabetic symptoms are likely already suffering from systemic toxicity. Lifestyle habits that increase toxins in the body, such as overeating, overworking, stress, lack of sleep, lack of exercise, and the consumption of alcohol, coffee, processed foods, and especially animal products, can act as the true causes of diabetes. Therefore, the diet for a diabetic patient should be the same as the diet for a healthy person. In other words, by adopting a plant-based diet, such as a vegan diet consisting of fruits, vegetables, nuts, and seeds, one can remove toxins from the body, supply proper nutrition, and regain health. In fact, several research results demonstrate how effective a vegetarian diet is for preventing and managing diabetes. The 1971 study by Kelly M. West and John M. Kalfleisch, Influence of Nutritional Factors on Prevalence of Diabetes, discovered decades ago that a vegetarian diet is effective in preventing diabetes. The 1985 study by David A. Snowdon and Roland L. Phillips, Does a Vegetarian Diet Reduce the Occurrence of Diabetes?, also proved that while high meat consumption increases the incidence of diabetes, the incidence rate among vegetarians is very low. Diabetes is a serious condition that goes beyond simple blood sugar issues and affects the entire body, with unhealthy lifestyle habits acting as the primary cause. However, the hopeful message is that it can be fully prevented and managed through changes in diet and lifestyle. In particular, a vegan diet can be a significant help in overcoming diabetes and promoting overall health.